Dr. Sills, I think everybody in the United States is basically watching the NFL and looking at the results that they see from the National Football League. And early this week, it was reported that there are only 12 players out of 2,800 approximately who are on what is called the COVID IR list, meaning that they could either be positive for COVID or they could be in close proximity with someone who was positive for COVID and thus was going through a testing regimen to make sure they're okay. What does that say about the progress of testing?
Well, there's one other group that actually can also be on the COVID IR, and that's a group that has had a positive test that hasn't been confirmed yet, so there are definitely some of those. But I think it says that, first of all, that we're keeping a very close eye on this situation, and obviously with daily testing and all the screening that we're doing, we have a tremendous amount of information coming in. But I think it also says that our clubs are doing a terrific job, meaning our players, coaches, and staff. Everyone is taking this very seriously. They're looking at how can they prevent risk for themselves and for that team organization. And I'm really proud of the work that we're doing there. Our teams are built on competition and excellence. And I feel like they've taken that same spirit of competition, not to compete against each other, but to compete against the virus. What can we do as an organization, as individuals, to make ourselves safe here? And I think that's showing up in the results.
So as we sit here right now, there's so many things that I'm sure you have to be concerned with on a daily basis. What are the things you look for every day when you analyze the results that you get from teams?
Well, we're always obviously first looking at new positive tests. Anyone who tests positive, and really what we call a novel positive, meaning you've never had a previous positive test. Because we know medically that if you've tested positive in the past, you can have a positive test for many months afterwards. That's just part of the unique features of this virus. So we certainly look at those novel positives. And then we also look at the contact tracing data to see how our teams are doing, with the distancing and making sure, if we do have a positive, what does that look like in terms of close contacts?
If you were to look at every team and the fact that the highest percentage on any team so far has been 1.7% positive tests on that team, that seems to be a lot more positive than I would have thought, particularly with people coming from wherever they were coming from all around the United States. What does that number say to you, that the worst team has been 1.7% positive tests?
Yeah, again, I would say, Peter, I was pleasantly surprised with that because I felt sort of like you did with people coming from all over the country and even all over the world in some cases, that we were likely to have a lot more positive cases when everyone came together. Because remember, those intake tests, they didn't show what happens once you're in the NFL facility. They just said, what are you bringing with you? What are you coming from the outside? But I think, again, that goes back to saying that our players, coaches, and staff, they were already thinking ahead and making sure they were taking precautions leading up to coming to training camp so that they arrived in the healthiest possible state. And so I think it's a very positive start, but to put it in football terms, that's the first series or the first drive of the game. We got a lot more game in front of us, and so it's a great start, but we've got a long way to go, and we have to remain vigilant because whenever we let our guard down, that's when we become vulnerable.
What, if anything, have you learned from baseball, where the Marlins, the Cardinals, now the Reds to some degree, have had some positive tests that have kept those teams off the field?
Well, first of all, let me take the bigger issue with that, and that is one of the really positive things I think out of this pandemic has been an unprecedented level of collaboration and cooperation among all the sports. I mean, I talk on a weekly or multiple times a week basis with the chief medical officers from the other professional sports leagues in North America, but also with sports leagues around the world. I mean, we've talked with the Bundesliga and the English Premier League and Australian football and rugby, and so we've in the past communicated, but it's so much more regular and it's so much more in depth now. And I think that's been a real positive because we've been able to learn from each other and share, really because we all face the same challenges. I think in baseball, again, they face the same challenges we all do, which is that day after day after day vigilance and the fact that it's what you do away from the team facility that really has a huge impact on the rest of the team. I think that's a message that all of us just have to continue to reiterate. I think that we also show that you can't test your way to safety. No matter how frequently you test, Testing doesn't make you safer. It's not about prevention. Testing is containment. Prevention is things like wearing a mask and washing your hands and avoiding crowds and not going out and putting yourself in a situation where you might get infected. So those are important lessons to realize. Testing is important, but it's only one piece of the puzzle.
I think one of the things that has been interesting to watch through the whole process, and again, I've only been to 3 training camps, but the vigilance, I was at the Titans yesterday having a talk with somebody, one of their PR people, and John Robinson, the general manager, came over and very sternly said, 6 feet, 6 feet, even though we both had masks on. So I think your lessons and your warnings are getting through to the right people.
Well, I do think our teams have done a tremendous job embracing this. We really challenged them, Peter, to say, we need you to reimagine and reinvent everything you do as a team, right? From the way you arrive and come in the building, to how you work out, to how you do medical treatment, to how you practice, to how you travel, and eventually to how you do games. All of that has to be completely reimagined and reinvented. And our teams embraced that challenge. Rather than running from it or pushing against it, they embraced it and said, okay, let's see how creative we can get. So I've been really pleased and I shouldn't say surprised, but just it's been very exciting to see what they've done and how the creative ways that coaches and staff and others have come up with to mitigate risk around their club facilities. And I think, again, they've done that in a collaborative way. Again, it's not about getting an advantage on your competitor. It's how can we think about our own unique situation and make it as safe as possible for everyone.
I had somebody in Tampa Bay Buccaneers camp said the real test that they had been talking about internally is going to be when players start getting their hands on each other. Everybody's done a good job of staying apart. I saw Tom Brady in his first huddle as a member of the Tampa Bay Buccaneers last Friday. Mm-hmm. So, maybe Friday, Saturday, Sunday, Monday, maybe you'd start to see some increases in the numbers. And I wonder, has there been any notable increase over the weekend, yesterday, today, with positive tests?
Have not seen anything yet. Obviously, it's still early, and that's something we continue to track, but we haven't seen anything yet.
Do you think that's a valid worry, or because everybody is negative, if negative goes against negative, even if they sweat on each other, it's not going to result in a positive test?
Well, that's what you'd hope. We've always said our best risk mitigation on the field is to arrive to the field uninfected, right?
Yeah.
That's the best thing you can do, is put a group of people on the field who are not infected. So I do think that's important, but I do think you're also going to see risk mitigation happen on the practice field, meaning people are thinking about position groups and how much time they spend around each other and how they group together and what's done during the teaching phase. And don't forget also, we have that contact tracing data from the chips that everyone is wearing that happens also during practice. So people will be going back as teams and looking at that and seeing, do we have exposure in certain areas? Are there ways we can further reduce the amount of time that people are close to each other, even though they're in a bigger environment? Obviously, we feel like there's safety in being either in an open air environment or in a big indoor facility where you've got a lot of ventilation, a lot of air dispersion. But I think you will see teams pay attention to those factors as well. And again, get everybody there in an uninfected state. That's the best thing we can do.
There's been some buzz about saliva testing, sort of the instant test. One of the attractions to that, which the NBA is looking into now, is that it's so cheap, relatively speaking. Mm-hmm. What is your opinion about saliva testing, and can that work at some point this year for the NFL?
Well, we've said all along that we expect our testing program to evolve, meaning that it'll change and it'll improve, because if you look at our season, we're talking about a 6-month period of time. And think about that for a second. It's been less than 6 months since this whole pandemic started. Kind of crazy to think about that, but think about how much has changed, how much progress we've made, how much we know more now than we did when we started. So if you apply that across a 6-month NFL season, of course things will change. Testing will get better, it'll get quicker, it'll get easier, it'll get more reliable. So we'll continue to track that very carefully and see what makes the most sense to move to. But for us, it's all about having, Peter, the most accurate test that we can, because a test that's only 85 or 90% accurate and is quick is not as valuable to us as one that's more accurate.
You have been, I won't say outspoken, but you have made the point that it's great to have a test if you could get it back the same day, but if it's only 85, 87% accurate, that's not as good as having a test you get back within 24 hours that is 97 or 98% accurate.
That's exactly right. Even the difference between 90 and 97% accurate is a huge amount when you look across a population of an entire
Because
state.
false positives really have consequences.
Sure, of course
Yeah.
they do. But even more importantly, false negatives have huge consequences. And that's what you don't want to see as a physician, right? If you have someone who's tested and you say, oh, you're clear, you're negative, you're not infected, and then you let that individual into the team environment and they are infected, that's a disaster.
Yeah.
So we have to really maintain our vigilance with the false negatives.
Would you say right now that it's likely that at some point this year you would be able to merge into the point of care test, the daily test, in some way as a reliable way, whether it be a saliva test or something else? Or is it just too early to tell?
Well, we're already using point of care tests some. We're using it as part of our protocol to confirm a novel positive test. When someone has a positive, it's one of the steps we take. And so I think as we gain more experience with it and as we see how it performs, we may very well introduce it more. I think one of the things you have to realize with the point of care is that there's a whole different supply chain in terms of reagents and the test supplies. And so you have to keep that in mind as well. Right now, that stream of supplies is not quite as robust as what we have for the other.
On the point of care test, is it a swab? Is it?
Yeah, so the point of care can be run different ways. Right now we're running it off a nasal swab, right? So whether you do the swab or saliva, the source is different for different types of tests. The thing with the point of care is it's a rapid antigen test as opposed to the PCR that we're running for the swabs that we're using, nasal swabs right now.
Right. You have also been very outspoken on the fact that this isn't just about the NFL, that you believe because the virus is going to be here for a while, and even when a vaccine comes into play, a vaccine is not foolproof either. There's going to be some percentage that it will not fix, it will not basically take away the possibility of getting COVID-19.
Right.
So why do you believe what the NFL is doing right now is so important?
Well, I think it's critically important, Peter, because we have to, as a society, as a world, learn to live with this virus. As you said, I don't think it's going to disappear soon. We all hope and pray that it does. And as you mentioned, even development of a vaccine is not an immediate fix. One of my medical colleagues here in Nashville, Dr. James Hildreth, has a great saying. He says that vaccines don't help people, vaccinations do. Right? So you got to get people to take that vaccine and it's got to work. So for that reason, I think it's important that we learn to live with the virus. And what I mean by that is there a way to do the things we enjoy and that are part of our lives and at the same time mitigate risk and protect people? And that's not a challenge just for the NFL or for professional sports. That's a challenge for businesses, for schools, for places of worship, for places of entertainment, everything that cuts across our society. And so that's why I think this is really important is, are there ways that we can mitigate risk and still get back to some degree of normalcy? And I would think that as the NFL, we're well positioned to try to lead that because of the resources we do have. But I often say, Peter, I hope that people are pulling for us. They should want this to work because if we can show a path forward here, that's going to be really important. And the learnings that we get, the knowledge that we gain, both positive and negative, is really going to help that effort for a lot of other segments of our society.
As you sit here now, I guess about 3 weeks into the program of testing, do you have much of a gut feeling right now whether this is going to work and whether the NFL can have a full season?
You know, Peter, if we've learned anything with this virus is that it's very unpredictable and it's taken twists and turns that we haven't foreseen. What I can feel confident in is this. I feel like we will make the best and the safest decision at every point. We've got great minds that are working with us and great collaborators. You know, our collaboration with the NFL Players Association on this issue is hand in hand. And I think that we will give it our best at each point and we will look at what makes the most sense in terms of safety, and all I can be certain of is that we're going to take the most reasonable and cautious set of steps moving forward, and that we'll do that very collaboratively. And I do feel that we've got a great program in place, a great set of protocols. I think our people are very committed to it, but this virus is unpredictable. And so we'll have to continue to be flexible and adaptable. I mean, that's the two words that everybody hears me say all the time. And things will change. The protocols we have today will not be the same protocols in a month or 2 months. We've already, amended them somewhat. That will happen throughout the course of our season. And this will be an NFL season that is not like any other season. This will not look like any of our previous 100 seasons. It's kind of interesting that we celebrated that last year. All of those 100 seasons, they will be totally different from this one we're in right now in every way. And I think that, we all crave that normalcy and we want to go back to what we know. But in this set of circumstances, I think it's about being flexible and adaptable and adjusting to what we have to do to keep ourselves safe.
When I talked to Dr. Fauci in May, one of the things he said to me was, hey, if you get, and I'm paraphrasing him, if you get 4 positive tests on one team in a week, you need to take that team out of commission for a couple of weeks. Now it seems like that really has changed, that the NFL doesn't have a magic number of positives in any given week. How do you feel about that, and do you think it makes sense to set a line of demarcation and say that if a team during the season has X number of positives in a week, that team has to go on quarantine?
Well, it is a really complex question, and let me try to give you a sense of how that plays out. So one of the things we've learned is not every positive test means a new infection. And some of those are persistent positives of people that have been infected before. Some of them are what we call unconfirmed positives, where they don't confirm on subsequent tests. So certainly we and others are learning that when you screen and test everybody every day, you're going to get some random positives that are in there that don't represent new infections. So I think that's why the positive test number alone is very difficult to use as a barometer. But clearly you have to factor in not just the test data, but the clinical data. How many new cases are we having? What is the time course that those are spread over? Who is it within the organization that's sick? What were their exposures? What were their close contacts? And so in some cases, 4 may be way too many cases. That may represent a major outbreak that's going on. In other cases, those 4 positive tests may not represent new infections. So I think it's a complex question, but again, it's not one we're going to solve alone. It's one where we're going to pull in our infectious disease experts, the local public health authorities, and make the best decision for the team and for the league as a whole. One of the things we have to recognize in this pandemic is the health and the safety of the team and the health and safety of the league as an entire community is more important than anything here. And so we have to safeguard that at all times.
Do you believe that fans should be able to go to the games?
I think, again, that's going to be a variable by region, depending on the state of the pandemic, depending on what the local public health authorities feel. I do think that we've seen through the course of the summer, there are ways to have public gatherings safely. There are ways you can do that. You can certainly mitigate risk by spreading people out, by using masks, by limiting numbers. There are a lot of measures you can take. And I think, again, our clubs and our stadiums have done a great job putting those protocols in place. But I think it's not just about the protocols. You have to, again, look at what's happening in that community. What's the level of transmission? What's the state of the disease? And so it's sort of a case-by-case basis.
Someone who knows Roger Goodell told me last week that, and I'll use these 2 words, that he is, and I quote, absolutely determined, end quote, to play football this year, not just to play football, but as a sign to America that life can go on, sort of the way the draft was and things like that. What's been your experience with Roger Goodell during the last few months?
Well, I would say that we've talked to each other a lot more than we ever have previously. It's a really regular stream of communication. And I think that I would say that I believe the commissioner is determined to try to do this in the safest possible way. And he does believe it's important for the reasons that we spoke about earlier, of showing that we can live with this virus. But I also know that he's absolutely driven by the medical facts. I don't think that there's this idea that we're just going to play football no matter what.
Damn the torpedoes, no matter, yeah.
I've never experienced anything that approaches that. I think it's, what does the medical science tell us? But I think he constantly challenges all of us to, are there creative ways that we can move forward and be safe? And I think the draft was a great example of that, right? There were plenty of people said, we should cancel the draft or never have the draft. And then a whole lot of other people that said a virtual draft will never work, right? You can't have people at their houses doing this Zoom draft. And he really stayed the course and said, let's make this work if we can. But what was driving that is, he would come to me and say, what do the public health authorities say? What are they telling us that we should do? And when I relayed that information, then he said, okay, that's how we're going to do it. So I think he's incredibly driven to move forward, but only in doing so with what makes sense medically.
Alan Sills, Chief Medical Officer of the National Football League, thanks so much for taking the time to talk to us.
Thanks for having me.
Hi, I'm Mike Tirico, and thanks for watching. Make sure to hit subscribe for the latest news and highlights from NBC Sports.